Hi, my name is Dwight Chen. Now I'm going to show you how to do stretching of the neck. And just like before, I want to remind you that before doing this, watch my introduction. And for the neck exercise, first we'll be doing the stretching of the scalenes. Scalenes, we have the middle scalene and anterior scalene and posterior scalene. The middle scalene is like from C2 to C7, and then will be inserted to the first rib. And the anterior scalene will be from C3 to C6 and also to the first rib. And then we'll be doing the posterior scalene from C5, C6 to the T2. Okay. And what we do is that we'll be doing this for middle scalene. And then we'll be upward rotation to do the anterior scalene. And then we'll do downward rotation to do the posterior scalene. Okay, so you put your head to the left until you get to a comfortable stop, and then be mindful of the middle scalene. Breathe in and breathe out. Breathe in and breathe out. Breathe in and longer breathe out. Now, I want you to pull your shoulder downward and pull your head on opposite direction, and so you can stretch that middle scalene. Breathe in and all the way up. Now rotate upward. So we'll be doing the anterior scalene, the C3 to C6. So breathe in. Now when you do this, push and pull the head so your neck will be stretched. Breathe in and breathe out. Breathe in and breathe out. Breathe in and longer breathe out. Now pull down your arm and shoulder and stretch your neck at the same time. Pull your head up at the same time. Breathe in and all the way up. Now rotate downward. Be mindful of the posterior scalene at C5, C6 to the second rib. Breathe in and breathe out. Breathe in and breathe out. Breathe in and longer breathe out. Now pull down your shoulder and pull up your head at the same time. Breathe in and all the way up. Change hand. Be mindful of the middle scalene. Breathe in and breathe out. Breathe in and breathe out. Breathe in and longer breathe out. Pull down your shoulder at the same time. Breathe in all the way up. Rotate upward. Pull up, pull your head up and lower your arm. Be mindful of the anterior scalene. Breathe in and breathe out. Breathe in, breathe out. Breathe in and longer breathe out. Pull down your shoulder at the same time. Breathe in all the way up. Turn your head downward. Be mindful of the posterior scalene. Breathe in and breathe out. Breathe in and breathe out. Breathe in and longer breathe out. Pull down your shoulder at the same time. Breathe in all the way up. And relax. Now we'll do the next stretch of the neck. We'll be doing the forward extension for the splenius capitis. And for this, you turn your head only 10 to 20 degrees. If you turn too much, then you're not stretching it. So turn about 10 to 20 degrees. And then you just pull your head forward, and so you'll be stretching the splenius capitis, which is from the nucha to down to like C7, T1. And then you're going to be doing the extension to 30 to 40 degrees. So this you'll be stretching the splenius cervices. And splenius cervices is like from C7, T1 down to like T5, 6, something like that. Okay, so we'll be doing the stretching. First, you turn your head about 10 to 20 degrees, and then you just bend your body forward so that your head can move forward. So be mindful, when you turn left, be mindful of the right. So breathe in and breathe up. Breathe in and breathe up. Breathe in and longer breath up. Now change to the other side. Breathe in and breathe up. Breathe in and breathe up. Breathe in and longer breath up. Now 30 to 40 degrees. Breathe in and breathe up. Breathe in, breathe up. Breathe in and longer breath up. Now 30 to 40 degrees, the other side. Breathe in and breathe up. Breathe in and breathe up. Breathe in and longer breath up. And relax. Next, we'll be doing the cervical spine rotation, which will be doing the SCM sternal head, and which is like when you turn your head, you'll see the muscle come up. There's the two heads. One head go to sternum. So we'll be doing the sternal head first, and then we'll be doing the cervical spine extended rotation, which is like you extend and then rotate. Extended rotation. That you'll be stretching the clavicular head of the SCM muscle. So this is basically for the SCM exercise. SCM stands for sternoclavicular mastoid muscle, in case you don't know. Okay, so you turn your head to the left first. Be mindful of the sternal head of the SCM muscle. Breathe in and breathe up. Breathe in and breathe up. Breathe in and longer breathe up. Now put your hand on the temple and push to the left. Be mindful of the SCM muscle. Breathe in and all the way up. And relax. Change side. Be mindful of the SCM muscle, the sternal head. Breathe in and breathe up. Breathe in and breathe up. Breathe in and longer breath up. Now hand on the temple. Breathe in and all the way up. And relax. Now, hands on the back, left hand hold the right wrist and pull down. And extend your head and then turn to the left. Be mindful of the SCM muscle, the clavicular head. Breathe in and breathe out. Breathe in and breathe out. Breathe in and longer breath out. Now I want you to pull down your arm so that your shoulder will be stretched and your neck will be stretched. Breathe in and all the way up. Feel the stretch of the clavicular head. Now the other side. Pull the arm And extend your head and turn. Be mindful of the clavicular head of the SCM. Breathe in and breathe out. Breathe in and breathe out. Breathe in and longer breathe out. Now pull down your wrist, your shoulder. Breathe in all the way up. And relax. Okay, we just finished the SCM. Now we'll be doing that cervical spine lateral flexion. This will be for the upper and middle trapezius. And then we'll be doing cervical spine lateral rotation and flexion. Then we'll be doing the levator scapula. Levator scapula is like from C, like a 2, 3, 4, 5, 6, 7, and down to that the scapula, the inner corner of the scapula. Okay, so what we do is that you do that right arm on the back and pull on the elbow, and then you pull right side and turn your head to the left, and then just lower your head just a little bit and pull further. Then you'll be stretching that the trapezius. And be mindful of the trapezia. Breathe in and breathe out. Breathe in and breathe out. Breathe in and longer breathe out. Now pull your arm, your shoulder at the same time and stretch at the same time. Breathe in and all the way up. Now change side. Breathe in and breathe out. Breathe in and breathe out. Breathe in and longer breathe out. And pull your arm at the same time. Breathe in and all the way up. And relax. Now we'll be doing that cervical spine lateral rotation. I forgot to turn it off, but right. That's okay. The cervical spine lateral rotation and flexion for the levator scapula. So you turn your head to the left first, and then your head to the shoulder as much as possible. Then we'll be stretched the levator scapula. Okay. So breathe in and breathe out. Breathe in, breathe out. Breathe in, longer breathe out. Now pull your arm and the shoulder down at the same time. Breathe in and all the way up. Be mindful of the corner of the scapula. And relax. And the other side. Turn and bend and pull down. Breathe in and breathe out. Breathe in and breathe out. Breathe in, longer breath out. Pull hard on that the elbow and the shoulder. Breathe in all the way up. And relax. Now we'll be doing the cervical spine rotation 45-degree upward, which will be just like this, 45-degree upward, and then 45-degree downward. This is a functional exercise for the neck. So maybe I don't need to turn it off. So just like this. Okay, so be mindful of your neck, and you pull your arm at the same time. Breathe in and breathe out. Breathe in, breathe out. Breathe in and longer breathe out. And then 45-degree down. Breathe in, breathe out. Breathe in, breathe out. Breathe in, longer breathe out. Change arm. 45-degree up. Breathe in, breathe out. Breathe in, breathe out. Breathe in, longer breath out. and 45 degrees down. Pull your arm at the same time. Breathe in and breathe out. Breathe in, breathe out. Breathe in, longer breathe out. And then we'll be doing that stretching of the neck for that neck flexion with hands below the occiput. The occiput here will put hand below the occiput. And then neck extension with a hand below the upper eye socket. The upper eye socket will go below it. And you need to take off the glasses when you do this. And so you can push that upward. And then we'll be doing the cervical spine rotation to the side like this. And then we'll do full rotation. Okay? So let me take off my glasses. So you do the neck flexion with hands below the occiput first. And you can try to keep your legs together and bend your knee a little bit so you can lower your head. Now be mindful of your neck muscles. Breathe in and breathe out. Breathe in and breathe out. Breathe in and longer breath out. Now be mindful of the cervical spine from C7 to C1 that we go up one by one slowly. Breathe in and all the way up. And relax. Now we'll do extension with hand below the upper eye socket and bend your head backward. And remember, if you feel dizziness, don't do it, because some people may have problem with that the blood vessels and may feel fainted. Okay, so backward. Be mindful of the front of your neck. Breathe in and breathe out. Breathe in and breathe out. Breathe in and longer breathe out. Now we're going to do the cervical spine one by one from C7 to C1. Breathe in and all the way up. And relax. And then with cervical spine rotation to the side. 1, 2, 3, 4, 5, 6. And push the hand on the temple. Breathe in all the way up. On the other side. 1, 2, 3, 4, 5, 6. All the way up. And then do the full rotation a few times. You should feel your neck more relaxed at this point. And relax.